Joining us now to talk about your health is Dr. Irina Burd, Chief of Women's Health at the University of Maryland Medical Center and Chair of Obstetrics, Gynecology, and Reproductive Health at the University of Maryland School of Medicine. Doctor, thank you so much for joining us.
It is truly my pleasure.
Tell us about your work and your main area of focus there.
So for many years, for over 20 years, I, as a maternal fetal medicine physician scientist, have focused on causes of preterm birth. We've done a lot of bench work, translational work on preterm birth, but what I'm realizing and this is a sober realization, that there's a lot more to preterm birth. And that is clear as I became the chair of the Department of Obstetrics and Gynecology here in West Baltimore at University of Maryland. What we see in Baltimore is really high rates of preterm birth. Nationally, nationally we're at 10.7% preterm birth rate. Maryland is not doing that hot overall as a state. We received a grade of D plus last year for 2022. We did improve to a C minus this year for 2023 scorecard for March of Dimes. But for Blacks, we're not doing that well. The rates actually grew from 13% to 13.1%. So that's far from the national or even Maryland's marks.
You've practiced medicine, you trained in the New York City area, the Philadelphia area. Are these problems universal? And for that matter, are there similar issues in rural areas that may have less access to good care?
That's an excellent point, Jeff, because where we are practicing here is similar sometimes to the areas in New York and Philadelphia. West Baltimore, right behind me, zip codes 21216, 21217, 21223, and 21229, historically been called red line districts, and they are separated from our hospital by MLK Boulevard. Very similar to other cities, actually, that have MLK Boulevard. There's a whole video on that folks should watch for these historically red line districts. And we truly need to help the folks in those areas. There are considerable barriers to care.
Well, talk about some of those barriers because you can get across Martin Luther King Boulevard there. It's not that wide. So, I mean, access to the hospital, nobody's really that far away, are they?
That's the key point here. So when we're talking about folks in those zip codes, and they're like in the butterfly area around us here, what we are actually talking about is folks who 40% of them have food insecurities. They don't own a car. Majority of them don't own a car. There is higher levels of unemployment. There is, of course, substance abuse. But truly, in order for them to come here, they have childcare issues, transportation issues, and there are issues associated with structural racism and health literacy. We really need to educate our own providers to take care of our underserved population, so they recognize themselves in our faces, so they understand what we tell them, and we take care of them the way they want to be taken care of, not that the way I want to be taken care of, because that my way probably may not be the way that they want to be taken care of.
So knowing what you do about the problem and the importance of that problem, because a preterm baby, I mean, the huge advances in NICU care, but still it can, at a minimum, get somebody's life started on the wrong foot. So given what you know about it, what is the University of Maryland Medical Center doing to address the problem?
So as you probably heard, our medical center is actually among America's best maternity care hospitals with 5 ribbons. And that's determined by, the rankings determined by patients, questionnaires and experiences, as well as hospital quality markers. We have all possible resources within the hospital to take care of these folks. right? We need to get them here, right? We need to educate them. And we truly cannot do this without subsidies from the state. We don't have insurance that covers it. And, as much as I would love to do that, we don't have resources at this time. We know that there is a critical need because it's not only about prematurity and prematurity related morbidity that we could take care of here in our NICU, right? But it also translates into infant mortality. Our infant mortality in this area is super high. As a mother of two children, I have to tell you, you don't have to go to another country to see the infant mortality, and the numbers are really sobering.
Um, I don't think this is like new information, but what should expectant parents, maybe expectant grandparents who can be involved in the situation, what should they know about getting this new life started on the right foot? It's about nutrition. What else is it about?
Well, it's about getting to patients, and we need more funds to get to patients. For example, they need to have childcare. They need to have transportation means to get here. Clearly, when they get to the hospital, and a lot of them are wage workers, right? So when they go to the hospital for a visit, sometimes it's a 2-hour ordeal to get here. So they're losing 2 hours of their wage works, right? So we need to create a system and we're working on this big grant that we're submitting to Maryland state to create the funds available for these folks to utilize Lyft, which is service to get to the hospital, to have care coordinators that keep in touch with folks who are at high risk and really can come either because of childcare, their work, et cetera, but they need to be coming for regular visits. So we identify a problem and we take care of them in a timely manner. So we know that number of visits with us correlates to better health. So the more they come, the better we're able to take care of their problems such as hypertension, diabetes, manage their diet and such so that we could deliver them as close to full term as possible.
I would guess there's a wide variety of ways that people pay for maternal care. I mean, you would have some people on Medicaid, you may have some people with commercial insurance, other forms of assistance. What you're saying is that they're not going to cover the things like transportation to the appointment that would make a difference in getting people there for more regular prenatal care.
Jeff, even more, we need to give these folks food also during their pregnancies. Even though they live in Baltimore, there are health deserts out there in a way that they have food desert. The closest place where they could buy, fruits and vegetables, it may be far. And again, not having access to a vehicle and having childcare issues sometimes provides a lot of barriers to this. So we totally need to be rethinking healthcare for our vulnerable population. We truly owe it to them. We have the resources to take care of them at the hospital. We have to bring resources to them, or we have to bring the patients to us. But we have to be rethinking about how we take care of our patients. It's not the model, oh, I have insurance, I could get the best care. There are other issues that we need to be thinking about here.
You're obviously passionate about this very important area, and you've done a lot of research. I know you've published over 100 research papers. What's the big focus of your research right now?
So what I study is how inflammation, intrauterine inflammation, impacts fetal brain development. So, and we do know that such problems as stress, and perception of structural racism that exists is as a stressful marker, and that stress converts into biological issues such as inflammation within mom, and that leads to preterm birth. So by taking away the stress, providing the best possible healthcare, meaning the folks who come here see themselves and trust. We need to also talk about health literacy and educate our patients about what is said in a language that they could understand. We need to have the same language. And as a as a foreign language speaker myself, I could tell you that's super important. That perception and understanding is super, super important.
Doctor, before we go, tell us what you're doing right now in the community on this issue.
Wonderful question. We already have a wonderful setup called Be More for Healthy Babies. We're working with School of Social Work, pediatricians, obstetricians, and on a smaller scale, in those zip codes, we are bringing to them the services such as Lyft, childcare, and also a lot of classes on health literacy and pairing on the small scale folks with the care coordinators. We also provide healthy food options at our Midtown campus and such, so local folks could come and shop for produce. Those produce markets are set up every week. So we do put the best foot forward. We need just more availability of that, and not just on a smaller scale, but take it to the larger scale.